Kia ora, I'm Sharon Talek. I'm one of the family advisors here at Specialist Mental Health based at Hillmorton, and one of the areas I cover is eating disorders. Yeah.
Kia ora, ko Heidi Ingoa. My name's Heidi. I'm a registered social worker and adolescent family therapist with the Eating Disorder Service based at Princess Margaret Hospital in Christchurch.
So we're going to be asking sort of a few questions and about in regard to eating disorders and disordered eating. So the first question I will put to you, Heidi, is what are some of the types of eating disorders and what is the difference between an eating disorder and disordered eating?
Good question. So there's lots of different types of eating disorders, Sharon, and I guess there's a lot online people can find out about, so I'm not going to go into a lot of detail. The main ones that people will be familiar with and that we treat are anorexia nervosa, bulimia nervosa, binge eating disorder, ARFID, which is the avoidant restrictive food intake disorder, and binge eating disorder. So the ARFID is going to be covered in another session, so I'm not going to talk about that today. I wanted to highlight a couple of differences between the three of them, and especially between anorexia and bulimia. So, as a lot of people will know, anorexia is really about people that have lost weight and have distorted body image. They don't realize that they're underweight. It's not based on BMI anymore. So in the old days it used to be a criteria to have a certain BMI, but they've recognized that for adolescents in particular, they might sit at what looks like a normal BMI, but it's not for them. So it's now based more on not having grown as they should have or gained weight as they should have through the adolescent years. Additionally, there is a subtype called anorexia nervosa binge purge subtype. So there's a restrictive subtype and the binge purge. So that people might confuse with bulimia. And with anorexia, it has the low body weight, and it's actually quite a serious subtype of anorexia because they're both underweight and purging, which can lead to a lot of abnormal physical parameters. Whereas bulimia nervosa, someone is more or less in their healthy weight range, or it's a little more hidden for that reason, but just as serious can be. It involves binge eating and purging, so usually by self-induced vomiting and perhaps by laxative use or exercise. So that's a key difference between those two. And then the binge eating disorder has the binge eating but without the purging.
Right.
Yeah.
Right. So what would be the difference between those and then perhaps disordered eating?
Yeah. So a lot of kids diet, right? It's play with dieting. It's terrible and it's serious and it shouldn't happen, but there's a lot out there for adolescents that is talk about healthy eating or getting healthy, and so they might play around with cutting out sugar or trying to get fit and exercising a bit. But most kids, they'll play with it a bit, and then they all go out with their peers and pig out on chocolate biscuits at the movies or something, and it's it just comes and goes and it doesn't actually stick. And similarly, they might decide to get fit and go to the gym a few times, but when it comes down to it, if they have an invite out to a party, they're going to go to that instead of go to the gym.
Right.
And it starts to tip over into an eating disorder when it's really impacting on their lives negatively, in the sense that the restricting becomes regular and sort of perhaps weight loss starts to happen, that the thinking changes, and I'm going to talk some more about kind of warning signs in a bit, but they also, if they start purging, and I think one big message here is purging's not normal. Like it can go through phases in schools of getting normalized, and actually even vomiting once isn't normal, and so really starting to get onto it if that's happening, and yeah, similarly with the binge eating, that it's starting to really impact on their lives. They're getting up late at night and they're restricting on their foods through the day.
Right.
Yeah, and it just becomes a pattern.
Right.